Welcome everyone to today's video, where we'll be showcasing the transformation journeys of multiple patients. So let's begin with the journeys of our three patients and see how their hair transplant surgery transformed their appearance, restored their hairlines, and boosted their confidence.
Three patients, three stories, and one common dream: to bring back their lost confidence. But wait till you see how their transformations turned out. Today, we're sharing the incredible journey of three patients who decided to take control of their hair loss and transform their lives with QHT Clinic. Each one faced a different stage of diffuse pattern baldness, a condition that not only affects your scalp but also your confidence. One of them was battling diffuse grade 3A baldness, where the thinning had just started, subtle yet emotionally distressing. The other two patients were facing diffuse grade 6 baldness, one of the most advanced stages, where extensive thinning leaves the scalp visibly exposed. After months of research, consultations, and hesitation, all three finally made a bold decision to trust QHT Clinic for their hair transplant journey. And that decision changed everything, because when it comes to regaining your identity, choosing the right clinic isn't just important, it's life-changing. If you're also struggling with hair loss or baldness, QHT Clinic is a trusted name. The clinic is now available in Haridwar, Delhi, Gurugram, and Hyderabad, making expert hair transplant care more accessible than ever. Let's take a closer look at the before conditions of our three patients before. Patient 1 was facing the challenges of diffuse grade 3A baldness. Their hairline had completely receded and taken an M shape. The frontal area was severely damaged, and thinning had started in the mid-scalp with partial damage. The rest of the scalp was still covered with healthy hair. Despite being in their 20s, this degree of baldness made them appear older than their actual age. After a thorough scalp analysis, our experts also assessed the donor area, which was fortunately thick, strong, and rich in healthy hair follicles, providing an ideal foundation for a successful transplant. Patient 2 was dealing with diffuse grade 6 baldness, an advanced stage. Their hairline had fully receded, the frontal region was completely bare, and thinning was noticeable in both the mid-scalp and crown areas. Thankfully, their donor area remained healthy and dense with strong hair follicles, making them a good candidate for transplantation despite the advanced hair loss. Patient 3 was also facing advanced stage diffuse grade 6 baldness. Compared to patient 2, their scalp was significantly more damaged. The hairline, frontal area, mid-scalp, and crown were almost entirely affected. However, the donor area in this patient was fortunately in good, healthy condition, providing a reliable source for grafts. These cases show how diffuse baldness can vary in severity, and also show why having a healthy donor area is very important to get natural and long-lasting results. After carefully analyzing the scalp condition of all three patients, our experts began the process of hairline creation, a step that sets the foundation for every successful hair transplant. The first step was trimming the hair, followed by a thorough head wash to completely remove dirt and oil, ensuring a clean and smooth surface for precise hairline designing. For patient 1, our experts designed a custom-shaped hairline based on his baldness pattern, starting from the glabella point and marking the affected frontal area with complete precision. In patient 2's case, the experts once again designed a personalized hairline according to his facial structure and then marked the frontal, mid-scalp, and crown areas which were most affected by baldness. Moving to patient 3, his custom hairline was designed to cover an even larger bald area, including the frontal, mid-scalp, and crown zones, ensuring that every inch of the affected region was well planned for graft placement. This meticulous hairline design and marking process acts like a blueprint for the surgery, guiding our experts during graft implantation. By following this plan, they ensure that every graft is placed with precision, resulting in a balanced, natural, and aesthetically perfect outcome for all 3 patients. Ready to bring back your hairline? Drop hair transplant in the comments below, and our team will reach out to guide you on your transformation journey. After a thorough scalp analysis, our experts carefully created slits to follow the natural hair direction. In patient 1, single and thin hair follicles were first implanted in the hairline to maintain a natural, soft look. Then, double and triple follicles were placed in the frontal and mid-scalp with precise spacing to cover thinning areas seamlessly. A total of 2,600 grafts were used, resulting in a dense, natural, and youthful hairline. The transformation brought back confidence and a refreshed appearance to the patient. For patient 2, the hairline was reconstructed with single and thin follicles for a natural front frame. Following this, double and triple follicles were implanted in the frontal and mid-scalp to restore fullness in affected areas, while the crown received a careful mix of single, double, and triple follicles to recreate natural density. With 4,500 grafts, the patient achieved a harmonious, balanced, and naturally flowing hair growth, making the scalp look completely rejuvenated. Patient 3 had a more extensive thinning area. Single and thin follicles were first placed in the hairline, followed by double and triple follicles to cover the large frontal and mid-scalp zones. In the crown, follicles were implanted in a swirl pattern, mimicking natural hair growth direction. A total of 5,500 grafts were used, giving the patient a full, natural, and long-lasting result. This comprehensive approach ensured not just density, but also a soft, natural hairline and overall scalp harmony. All grafts for all 3 patients were taken from safe donor areas which are DHT resistant, ensuring the results are strong, natural, and long-lasting. If you're also struggling with hair loss for years just like him, then take the first step today. Book your consultation and start a journey towards a new you. Now, let's take a look at some exclusive post-surgery pictures of patient 1, personally shared by him with us. These images will help you understand how the scalp looks and heals during the initial days after a hair transplant and how recovery gradually takes shape day by day. This is day 1, where the freshly implanted grafts are clearly visible and slight redness can be seen, a completely normal part of the healing process. By day 2, the redness and swelling start to subside and the grafts begin settling into their new positions. On day 3, the scalp looks much calmer, showing visible signs of recovery as the healing process becomes more active. By day 4, tiny scabs start forming on the implanted area, which is a positive indication that the grafts are safely taking root. And by day 5, the scalp appears much healthier, with redness almost gone and the healing phase progressing smoothly. Within just a few days, you can clearly see how the patient's scalp begins its natural healing journey, marking the very first step toward a remarkable transformation. Let's now take a detailed look at the step-by-step follow-up journey of our 3 patients. And at the end, we will showcase their final results. When patient 1 visited the clinic for his first follow-up PRP session, our experts observed around 60% shedding on his scalp. This is a completely normal part of the post-transplant process. At the same time, his donor area had fully healed, showing healthy recovery and excellent progress. One month after the transplant, When patient 2 visited the clinic for his first follow-up PRP session, our experts observed around 50% shedding on the scalp. At the same time, his donor area had completely healed, showing excellent recovery and readiness for the next phase of growth. One month after the transplant, patient 3 experienced around 70% shedding on the scalp, which is completely normal at this stage of the hair growth cycle. At the same time, his donor area had fully healed, showing excellent recovery. Compared to patients 1 and 2, his baldness was more extensive, making his transformation even more remarkable. Over the upcoming months, the transplanted follicles will start settling and producing new growth, setting the stage for impressive, natural-looking results that will showcase the effectiveness of the procedure and careful post-surgery care. After your hair transplant, along with PRP, you can also opt for advanced therapies like GFC and QR678, which are designed to further enhance hair growth. These treatments are essentially next-level versions of PRP, offering faster and more effective results. The best part is that these therapies are not only available at our Haridwar clinic, but also at our Delhi and Hyderabad branches, ensuring you receive the same world-class care and hospitality wherever you visit. If you want to know more about PRP, GFC, QR678, or any other hair restoration treatments, don't wait any longer. Book your consultation today at the number provided and take the first step toward a thicker, healthier, and more confident mane. 5 months after the transplant, patient 1's hairline had beautifully framed his face. The frontal and mid-scalp areas had achieved remarkable volumetric growth, and even the previously thinned regions were now completely covered with healthy hair. His confident smile clearly reflects the transformation he has experienced. Keep in mind, these results are just after 5 months, and the final outcome is still on its way, which you will see in the upcoming months. Three months after the transplant, during his second PRP session, our experts noticed that shedding was still ongoing. This is a completely normal phase, as the transplanted follicles shed to make way for stronger, healthier roots to settle into the scalp. In the upcoming months, these roots start producing visible hair growth, setting the stage for impressive results. Five months after the transplant, patient 3's scalp showed remarkable progress. His newly designed hairline was perfectly framed, and the frontal area had achieved noticeable density. The native hairs had beautifully blended with the transplanted ones, creating a seamless and natural look. Even the crown region had started forming a defined swirl pattern, giving a realistic and voluminous appearance. His donor area had completely healed, showing no visible signs of extraction. And remember, this is just the 5-month progress. In the upcoming months, his results will continue to improve, revealing an even fuller and more refined transformation. 7 months. Post-transplant, patient 1 achieved outstanding growth. These results, of course, vary from patient to patient. Consistently following prescribed medications, adhering to the doctor's precautions, and attending timely PRP sessions all play a significant role in achieving such results. With proper care and commitment, similar transformations are absolutely achievable. Ten months after the transplant, patient 2 achieved a remarkable transformation. His hairline is perfectly framed, the frontal and mid-scalp show dense and voluminous growth, and the crown exhibits a flawless swirl pattern. What makes this result even more impressive is that many believe achieving such results with curly hair or diffuse thinning patterns is challenging. Yet patient 2's outcome is truly flawless. You can clearly see the natural thickness, coverage, and overall aesthetic improvement, highlighting the effectiveness of the procedure and expert care. 12 months after the transplant, the patient achieved truly remarkable results that speak for themselves. When we compare his current look with his earlier condition, the difference is nothing short of inspiring. His scalp, which was once severely bald and damaged, is now covered with strong, healthy, and natural-looking hair. The hairline is beautifully shaped. The frontal and mid-scalp areas are dense and uniform, and the crown has developed a natural swirl pattern that blends perfectly with the rest of his hair. His transformation is not just physical, but emotional too. The confidence and happiness on his face clearly show how regaining his hair has completely changed his personality and outlook. It is a perfect example of how expert planning, precision, and trust in the process can bring life-changing results. If you have any questions regarding your hair loss or baldness, then drop them right now in the comment section below. Question 1. What types of hair care products should be used or avoided post-transplant? Post-transplant hair care products should be chosen carefully to support healing and graft survival. In the initial weeks, patients should use mild, sulfate-free shampoos that cleanse gently without irritating the scalp. Avoid products containing alcohol, harsh chemicals, or heavy oils, as these can dry the scalp or clog follicles. Medicated shampoos with ingredients like ketoconazole may be recommended to reduce inflammation and prevent infection. Styling products such as gels, waxes, and sprays should be avoided until the scalp heals fully. Using gentle, non-irritating products minimizes the risk of graft damage and promotes healthy hair growth after a transplant. Question 2. Are there any dietary recommendations that can support hair growth post-transplant? Yes. Adopting a nutrient-rich diet post-transplant can significantly enhance healing and support robust hair growth. While no diet can guarantee faster results, certain foods promote follicle strength, scalp health, and optimal recovery. Key dietary recommendations for post-transplant hair growth. 1. Prioritize protein-rich foods. Hair is composed primarily of keratin, a protein. A protein-deficient diet can weaken hair strands and slow regrowth. Include eggs, chicken, fish, lentils, and dairy for a well-rounded protein intake. 2. Boost your vitamin C intake. Vitamin C aids in collagen production, which is essential for strengthening the scalp's blood vessels and promoting healthy follicles. Include citrus fruits, bell peppers, kiwi, and amla. 3. Iron for oxygen supply. Iron helps red blood cells deliver oxygen to the scalp, ensuring optimal follicle function. Spinach, kale, red meat, and pumpkin seeds. 4. Biotin for keratin production. Biotin helps strengthen hair strands and supports new hair growth. Include egg yolks, almonds, sweet potatoes, and mushrooms. 5. Zinc and selenium for follicle repair. Both minerals play key roles in cell repair and immune support, accelerating recovery. Include pumpkin seeds, cashews, and Brazil nuts. As you have seen, our 3 patients have undergone incredible transformations from bald to bold. Take a moment to look at their results and tell us which transformation impressed you the most and why. Every patient's journey is unique, showing how personalized treatment can bring such natural and life-changing results. If you also want to achieve a remarkable transformation on your scalp, just like our patients, now is the perfect time to take the first step. Book your consultation with our expert team today and start your journey towards a confident, fuller, and healthier head of hair. Your new look and renewed confidence are just a consultation away.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.